Welcome. This is Dr. Nettleman bringing you For Your Health again. Today I have the privilege of having Dr. Veena Mathew, an ophthalmologist who's new to the area. Perhaps you could tell us a little bit about yourself.
Sure, absolutely. So I'm Dr. Mathew. I have been in Boston now for about a decade doing my training in ophthalmology. And now I just recently joined Eye Health Services, which is a large practice that's spread along the South Shore. We have offices that I'll be going to in Quincy, Weymouth, Easton, and Plymouth.
I understand they've moved their exam rooms from the 18. So many people know Route 18, Eye Health. They're over in Libby Parkway now.
That's correct. There's a new beautiful office building there now at 97 Libby Parkway. Surgeries are still being done at the old Weymouth office.
Right. Very good. And the type of ophthalmology that you practice, would you say it's more or less general?
Yes, it is. It's general ophthalmology, comprehensive, so dry eyes, diabetic eye exams, cataracts, macular degeneration screenings, glaucoma screenings, things like that.
Would you spend a minute just distinguishing for the audience the difference between eye doctors?
Sure, absolutely. So there's three that people confuse. There are opticians, optometrists, and ophthalmologists. Opticians are the practice of making glasses. They will actually create the glasses for you. They're who you meet when you go to an optical shop. An optometrist you would usually go to be checked for glasses or contact lenses. They do 4 years of schooling for that, and then they are full-blown optometrists. For ophthalmology, you've done 4 years of medical school and then an additional 4 years of training in ophthalmology. Some people also pursue a fellowship after that to further specialize. And that allows you to do not only see patients in the clinic setting and do medical ophthalmology, but also surgeries. So being able to do lasers and actually surgery on the eye requires you go to medical school.
I see. And we're going to talk about some of the perhaps more common or more frequently occurring things today. And you had, first of all, the red eye, the eye that the patient has some irritation, but it's inflamed and it's caused red, and it's red. What generally causes this rather common condition?
So red eyes can be caused by a whole multitude of different factors. There is a thin tissue that overlies the white of the eye that's filled with blood vessels, and anything can really irritate that or cause them to flare up, making the eye red. Now, this can be anything from dry eyes, some allergies in the eyes, to a viral conjunctivitis or pink eye, which we can talk about more later, but even infection or a more serious inflammation in the eye. It's a whole host of symptoms that lead you to a certain diagnosis. For instance, if they're contact lens wearers, if you've been sick recently, if you have light sensitivity or discharge or itching in the eyes, all of that, as well as what the eye would look like on exam when you're seeing a doctor for it, all of those contribute to how you would want to treat it. We don't recommend using drops that get the red out, as they say, Visine, Clear Eyes. Those actually have a preservative in it that can make the eyes more red when you stop it, so it becomes a whole cycle. So it's important to actually know what's causing the red eye before being able to treat it adequately.
And is this usually itchy or irritated as opposed to painful?
Well, it can be. Again, it depends on what exactly is causing it. So something common that we do see are people complain of their eyes feel dry or irritated, like they're gritty, like there's sand in it. The most common cause of that in the regular population without any other eye problems is that they get dry. They can get dry again for a multitude of reasons. The environment can contribute. This time of year, as the heat comes on, that can contribute too. But also a problem called blepharitis, which is plugged up oil glands around the eyelids can cause those oils to sit there and irritate the eyes and make the tears evaporate too fast, so the eyes get dry.
Do you distinguish this red eye from a pink eye?
Sure, so it's the other symptoms that might lead you more to a diagnosis of pink eye. What pink eye actually is a viral conjunctivitis. So colds, the common cold that people get, again, this time of year with the seasons changing, you can get a cold in the eye. The same viruses that cause you to have a runny nose and cough, all of that can also affect the eyes too. And we treat it more conservatively, actually, which is using cool compresses and artificial tears. Sometimes you can just put the artificial tears in the refrigerator, and that helps it to feel better when it's going in. But we're talking about the itchy eye with tearing or discharge. You can sometimes get a yellowish discharge, but it's most commonly just caused by a virus. The important thing to note is it might start in one eye, but it's very likely to spread to the other eye. So hand washing is very important. Right. And it's very contagious, so it can spread to other people as well. So hand washing is key to prevent it from spreading.
When a patient comes in with this kind of problem, or a problem involving the eye, two things that I'm always concerned about, and that the first one, whether they're photophobic or light sensitive, and the other one, to try to distinguish irritation from pain.
Yes.
And these, a painful eye and one that is, that the light is sensitive to the eye, has always bothered me a lot. Why would this be the case?
So, if we think about the actual anatomy of the eye, the very front surface of the eye is the cornea, and that can be very, very sensitive. Usually if it's dryness related to that, that might be more irritation, feeling like there's something gritty or sandy in the eye. You're usually not going to be very light sensitive with that. The photophobia actually also makes us more concerned as ophthalmologists, because it can indicate that there's inflammation further inside the eye, not just on the surface, like what we were mentioning before. So if there is inflammation in the eye, that's what we call an iritis or a uveitis. That makes the iris, the colored part of the eye, actually react a little bit, and that's what makes them light sensitive. But different things can actually cause that. Sometimes even a conjunctivitis can cause light sensitivity, but you're going to have itching with that. You're going to have some kind of discharge with that usually.
The fine line to distinguish it.
Yes.
And then, of course, there's the patient that comes in that doesn't even know he has a red eye. It's bloody red, and he happened to look in the mirror in the morning, or somebody said to him, "Gee, your eye's all red."
Yes.
How do you explain that?
So this is what's called a subconjunctival hemorrhage. It can occur spontaneously, and it appears much more frightening than it actually is. It's completely harmless. But basically, it's just a broken blood vessel. If you imagine it's behind a thin sheet, so it spreads out, and that's what gives it that bright red appearance that's frightening. But it will just go away in 2 or 3 weeks on its own, spontaneously. There's nothing to do to treat it. It can occur spontaneously, especially in people who are on blood thinners like Coumadin, but it can also occur with any kind of strenuous activity, coughing, straining, heavy lifting, even straining.
And if perhaps they got touched in the eye or the day before,
Absolutely.
right?
Yep, if you're rubbing the eye.
In their sleep, right?
Exactly,
right.
You can just wake up with it.
Right, it's very frightening, and these patients, as I say, don't even know they have it.
Exactly.
And it doesn't affect the vision, and there's no symptoms at all.
Right.
Let's move on now. You've mentioned dry eyes, but explain the normal wetness or lubrication of the eye to our audience a little bit.
Sure. So the way the eye is, the way the eyelids are going to affect the way your tear film is. Naturally, for healthy eyes, you can blink normally if your lids are in the correct position. That's one thing that's going to contribute to your eyes not becoming dry. People who sleep with their eyes a little bit open, or if your eyes don't fully close because you have more prominent eyes, those people might wake up in the morning just feeling like their eyes are dry because their lids have not been completely closed. So the lids are one factor. Then we have glands in the eye that produce the tears. So either underproduction of the tears can make the eyes dry, and that can be caused by different autoimmune diseases, or there's a tear drainage system in the eye. All of this has to be in balance. That tear drainage system, if that's not working adequately, then your tears then it's not gonna work correctly as well, and the eyes can get dry.
And that leads us to styes and chalazion. Could you elaborate on that a little bit?
Absolutely. So these oil glands that I was mentioning previously, they line the eyelids, the bottom lids and the top lids. And for those to work properly, we need to have good lid hygiene. And if we don't, these oil glands can get plugged up. When they get plugged up, we need an oil film there on the tears so that they don't evaporate too fast. And when those oil glands are plugged up, your tears evaporate too fast, you end up with dry eyes. And itching and burning and all those symptoms that go with that surface irritation. The oils themselves do it. So what we recommend for that is actually doing warm compresses. Just the way we clean the rest of our body, we have to focus that attention on our eyes as well. So what I recommend to patients when you're in the shower, just gently massage the eyelids as well, just with a warm compress, and that helps to open up those glands better so that they're working.
And the sty, people refer to it as a pig sty, but it's a sty.
It's a sty.
These are the glands that are right on the lid?
Yes, so what ends up happening is if these oil glands get plugged up, then those secretions can accumulate there, and then you end up with a bump on the eyelid, which is a sty. It's the difference between a sty and a chalazion. A sty is usually going to be tender, inflamed. Sometimes when you blink, you feel just this soreness to it. If you touch it, it's a little tender, and it might be a little bit red. But that's usually people who have blepharitis or those plugged up oil glands around it are the ones who are prone to getting these. If it's been there for a while and doesn't go away, using warm compresses and so forth, and becomes not tender anymore, but just a bump that's there, doesn't hurt or anything, that's a chalazion. Warm compresses can get rid of those sometimes too, doing them frequently enough and making sure that you massage the area. But if they don't go away, then you come in and see us and we can actually remove it.
How about it? I believe you have some pictures of the red eye, pink eye, the chalazion.
I do.
How about if we look at those and you can comment on them?
Absolutely. So this is probably just a chalazion and not a sty, because you can see it's not terribly red. If she came in and told me this isn't tender at all, it's been there for weeks, then that would be a chalazion. You'd recommend the warm compresses. If that's not working, then we can remove it in the office. Now, styes, when they're inflamed, can actually become more severe. So if this became very red and the whole lid became swollen, this is a severe case of it with the upper and lower lid swollen. But suppose the sty was here and this whole lid has become more and more swollen and more red. It's very tender. Painful to look around, anything like that, you definitely want to go in and be seen in the emergency department or see your local eye doctor, only because that can be a sign of there being an infection there, which can become serious quickly and spread further beyond the skin into the eye socket, which is what we worry about. And if that were the case, then it would need more rapid treatment.
Do you have any other pictures that you'd like to cover now? I know we went beyond the pink eye and the red eye, but if we go back
No, that's
a little
okay.
bit.
I think that's it for the red eyes and the skin around it. We can move on to the
Okay.
other issues.
The next thing that you have listed here is your macular degeneration. And now we're in the eye itself.
Now we're in the eye.
In the
yes.
eye, not the covering and not the lids. So could you tell us what is macular degeneration?
Yeah.
we're hearing so much about now as the population
Yes,
ages.
exactly. So if we actually break it down, the macula is a part of the retina in the back of the eye that controls the central vision. It's a very thin tissue, and the degeneration refers to over time related to age. You can get deposits that form back there, and that can affect the vision centrally. There's two different kinds of macular degeneration that we talk about. There's dry macular degeneration and there's wet macular degeneration. This is basically an anatomic difference, but in terms of treatment, it matters. Dry macular degeneration is what 90% of people who have macular degeneration, what they have. And what that is you get deposits in the retina. So let me just go to this picture briefly. This would be, if you had advanced macular degeneration, what the world might appear like because it's affecting your central vision. This is as opposed to something like glaucoma that affects the peripheral vision, the sides of the vision. This is more of a central issue. This is what dry macular degeneration can look like. This is a more advanced form of it, but you have many deposits in the retina, these yellow deposits that can only be seen on an eye exam, actually, a dilated eye exam, which is why those are important.
We're looking at the very back of the eye.
This is the back of the eye, the retina. So it's a very thin tissue, and you get these accumulations that occur there. Dry macular degeneration that's what most people have, and it's fortunately less severe because there is not a treatment for it at this time.
There is.
If it's very advanced, in certain cases, there are vitamins that can be taken that can be purchased over the counter, but they're in specific cases. It doesn't work for the general population who has no signs of this to prevent it. They studied that at the NIH. And in certain cases, for people who are at risk of developing the more advanced disease, then they can take the vitamins that can help to slow the progression but not necessarily prevent it.
I see.
The other kind is wet macular degeneration. Wet macular degeneration means that you start looking the way that this picture is, but then it becomes, let's go here, but then it becomes wet macular degeneration, which means that abnormal blood vessels can grow and can leak and cause bleeding in the back of the eye. Fortunately, this is much less common because, as you can see, this is much more severe. There's bleeding in the back of the eye, so this is what typically affects the vision much more. The good thing is that when it is in this stage, there is a treatment for it, but the prognosis is not as good as when it's earlier on.
Are there certain conditions that are behavior that predispose to either wet or dry macular degeneration?
Between the two, no, but smoking is one known risk factor that really increases the risk of developing macular degeneration and of progression once you have it. So smoking is the key risk factor that absolutely we discourage smoking for that reason. Having a family history of it can also increase risk, and age over 50. Light eyes, light hair, Caucasians are actually at higher risk of macular degeneration.
And what would you say is the average age of the patients that come in with this condition to see you?
Well, over the age of 50, but if you pick it up early enough, you can watch it and make sure at least that it's not getting worse or that it doesn't get to the point that it requires treatment. That might be well into 70s, but you want to pick it up early enough. That's the key.
And a patient who isn't a drinker or a smoker and gets the dry macular degeneration, it's just something that is age-related, and you can't do a heck of a lot for it.
Exactly. But at least you can be monitored to make sure it does not progress to that wet form.
Okay, that it does
That's
not.
the key.
So the dry can convert
Progress.
over or progress to the wet.
Yes, definitely. And for those people who are at risk, that's who the vitamins are recommended for to slow that progression.
I see. Very good. And do you have any other slides that you wanted to show us on the macular degeneration?
Not for the macular degeneration. The key is don't smoke. Healthy diet actually is also helpful. Eating leafy greens, things that are good for the rest of the body are good for the eyes too, like that.
When you say leafy greens, what are you really looking for?
Well, vitamin A.
Okay.
Vitamin A, vitamin E, and omega-3s actually are helpful.
And these are the things that are in the vitamins that you can buy.
Yeah, it's a very certain formulation. There's zinc, there's copper, there's beta-carotene, there's a variety of different vitamins that have been studied specifically for this purpose.
Very good.
It's not a substitute for a multivitamin.
Okay.
If you're on a multivitamin already, you would still take this additionally.
Good, please. And I think for the next topic, you have glaucoma.
Yes. So glaucoma. We all hear about glaucoma. It's something we dread because, like macular degeneration, it can lead to blindness. Again, because they're both silent diseases of the eye that you just have to be screened early enough to make sure it's not a problem. So glaucoma, what is it? It affects the nerve in the eye. The optic nerve is a cable between the eye and the brain. It's the only nerve in the whole body that can actually be visualized on exam. But what glaucoma is damage to that nerve in the eye, which can occur from having a pressure that's too high in the eye. But it's something like high blood pressure. Unless you're checked for it, you don't know that you have it unless it's very, very far advanced. When the nerve gets damaged, then it can affect the peripheral or the sides of the vision. I'll show you a picture of what that can look like. So someone with normal vision in the right corner, early glaucoma starting to affect the sides of the vision. I'm starting at the right corner bottom and going up from there. And then advanced or extreme glaucoma, you end up almost with a tunnel vision, and eventually it can wipe out all the vision, which is why it's important to be screened for it. And what we're looking for, this picture on the right, is what a normal healthy nerve looks like. You have a cup on the inside, that white smaller area, which, let me see if I have a pointer here. So this area is the cup here. That's nice and small and healthy as it should be. In this picture, this is a picture of advanced glaucoma. Sorry. This is a picture of advanced glaucoma, but you can see here, this cup, this white part on the inside, is very enlarged, and that's what we're looking for on the exam. This isn't going to cause you to necessarily have pain in the eye or anything like that, which is why it's important that it's picked up early to prevent it from getting to that stage. If you don't check, you just don't know that it's there. So people who are at risk for this, again, having a family history is a big contributing factor. Also being of African descent, anywhere in the world, but being of African descent is a risk factor as well. Having high pressures are the risk factor that we can control. So when you're seen for your eye exam, we always check your pressure because it's a screening technique too. The normal pressure for the normal population is somewhere between 10 and 21. However, if you have glaucoma and your pressure is 18, even though that's in the normal range for a normal eye, if you have glaucoma, that could still be too high for you. So the treatments for it, there are drops that are used to lower the pressure. There's also laser that can be done to lower the pressure in certain patients. And this is for the most common type of glaucoma that we see, which is called open-angle glaucoma.
So in macular degeneration, we have loss of central vision. In glaucoma, we have loss of peripheral vision.
Exactly.
That moves in.
Moves in. Exactly.
And how often would you recommend that patients have eye examinations?
Yeah,
Beginning
so
at what age?
a young, healthy person, doesn't wear glasses, anything like that, they don't have to have an eye exam, honestly. For children, it's a different story. If you're talking, it's now required in the state of Massachusetts before the age of 5, before they're entering kindergarten, they need to have a vision screening because that can sometimes these children are labeled with learning disabilities and so forth, but it's just that they're not able to see the board. So there's a screening for that. Between that, if you're a glasses wearer, you should have an eye exam every 1 or 2 years if you're young and healthy otherwise, young adults. Baseline exam, though, at least at the age of 40. Earlier, if you have a family history of glaucoma. After you're 40, every 1 or 2 years, depending on what's found on the exam. Right. If everything looks healthy, they'll probably just tell you come back every 1 or 2 years. But after the age of 50, the American Academy of Ophthalmology, who develops these guidelines for us nationally, recommend every 1 to 2 years. After the age of 60, at least once a year. But again, it depends on what is found on your eye exam. If there's something that needs to be screened or monitored more frequently, then they might bring you back sooner than that. People who have diabetes need to have an eye exam every year without fail. Again, because it's something that can be picked up early.
Right. Right. Very good. Well, in the last minute or so that we have, we've talked about red eyes, pink eyes, and you mentioned how contagious this is, and people very quickly, eyeliner, contacts, you should change them or get rid of them in between. And we've talked about macular degeneration and glaucoma, chalazions and styes.
Covered a lot.
We've covered a lot. And I wish you good luck.
Thank you.
In your new position. I'm sure you'll be seeing some patients from Braintree, and they may mention that they saw you on the program here.
Oh, absolutely.
And if you have other topics that you'd like to discuss, please let us know.
Absolutely.
Thank you very much,
Okay,
Dr.
thank you
Mathew.
for having me.
This is Dr. Nettleman bringing you For Your Health.